Okay, hi listeners. Welcome to the Women in Sports Therapy podcast from the Sports Therapy Association. We're your hosts. I'm Fiona.
And I'm Debs.
Today we're discussing endometriosis, including influential factors such as genetics, environment, and socioeconomic factors. We've also got some signs and symptoms of endometriosis, and we'll talk about diagnosis, symptom tracking, including the use of diaries and apps, as well as where you can go to get some help if you're experiencing symptoms of endometriosis, including areas such as diet and hormonal therapies, as well as surgery in some extreme cases is necessary. So Debs has had some experience working both with endometriosis clients, Endometriosis UK, which is a charity in the UK that supports people with endometriosis, either diagnosed or before diagnosis. And she's also got some personal experience of endometriosis. So Debs, are you happy to have a chat about your experiences today?
Absolutely, no problem.
Cool. Okay, so just to kind of actually start out, I suppose we probably should discuss, or at least have a kind of snapshot of what your kind of experience of endometriosis is, just to give the listeners a summary if they haven't already encountered you through the STA podcast episodes. So can you tell us a little bit about your story?
So my own endometriosis journey started when I was about 13 years old, when my period started. And I was in a lot of pain. I used to take something, and I've now seen it back on the shelves, called Feminax, which is aspirin and paracetamol. Sadly, I'm now allergic to NSAIDs, so non-steroidal anti-inflammatory drugs. A lot of women will take endometriosis pain to an extreme and not realise it by popping a load of pills, and a lot of the time it's anti-inflammatories. However, I can't take those anymore, and I never knew anything about endometriosis. And when I was 17 years old, I went onto a pill called Dianex, which is a very old style pill now. I'll pick that up a bit later in the podcast, where I'm at with that now. And then I went through life pretty much quite normally until I came off the pill, became pregnant with my son at 22. And then by the time I was about 27, came back off the pill again because they said I was too old to be on it. And I was registered at stage 4 endometriosis. So there are 1 to 4 stages, and stage 4 is basically a whole pelvis is just completely obliterated. A lot of mine was in the pouch of Douglas, and my bowel was knitted to my spine. So I had to have 4 laparoscopies over a stage of about 6 years.
Just to interject, what is, for those who may not know, what is a laparoscopy? Laparoscopy. I can't even say it.
A laparoscopy is, they say non-invasive surgery, but it's actually, it's keyhole, but it can take longer to heal from than a cesarean section, and it can be much more invasive than it looks. But they go into your abdomen. Most endometriosis deposits are sitting within the pelvis and not within the womb. So what happens is that they need to go into the pelvis. They have to blow up your stomach, and then they go in via cameras and tools, so both sides of your pelvis and through your belly button. So when they're finished, they have to deflate you. That takes a few weeks as well, lots of peppermint tea. And then you're left with sort of tiny little scars on the abdomen, and your belly button has a new look.
Oh, wow. Jazzy.
And then hopefully you will be pain-free for a little while longer. Sometimes some women have pain done and that's it. Other women, they may end up having to have a number of laparoscopies. I'm very lucky with only 4, which sounds horrific because it's quite major surgery, even though it looks minor. And to go through it 4 times is quite a lot, but there are women that have been through it 10, 15 times because endometriosis cells grow. So if there's a lot of estrogen within the body, or women are eating things that are mimicking estrogen, such as soya, linseed, anything like that, and they're still below the age of 30, it will mimic the estrogen, which can then cause an effect on the endometriosis.
Wow. Oh, that's fascinating. I find that like the level of complexity when it comes to like particularly things that we eat or that are in our environment that can mimic other chemicals such as hormones, quite a big area that I don't know very much about, but I'm absolutely fascinated by that. So yeah,
because there's a lot of chemicals that we use on a daily basis. For example, women tend to use a lot more products than men tend to do, although that's changing for sure. But you know, shampoo, conditioner, bubble bath, shower gels, and we tend to not lean towards the naturals. I think that is changing. But I think people are much more aware of things not containing BPA, you know, in plastics or phthalates in the shower gels, which are ingested by our skin, and our skin is the biggest organ we have. And as soon as we notice any changes, we'll notice changes in our skin. So, for example, when we go into surgery, they say no nail polish, you know, because they need to check under your nails to see if it's the right colour. Because our skin is an indicator, you know, if there's patches or whatever, it's a very big indicator of our health. So if we're putting stuff on it, and of course, as we're ingesting stuff through our skin, it can affect our hormones, it can affect the levels of estrogen as well. So for somebody that carries endometriosis, it can be quite a difference, I think.
Significant, definitely. I feel like we veered off topic a bit. That sounds like an episode, doesn't it, really, in itself? Maybe we will come back to that one.
Go back to that.
So how about, I think we got up to the point where you were explaining your surgeries and at that kind of like point in your journey, and I think there was a mention of a chocolate cyst. So on your bio, or at least the notes that we've got. So that sounds like an interesting term. Maybe you can explain that.
So there are all sorts of added complications. So a gynaecologist that specialises within endometriosis. So there are something called the BSGE. So it's a website that you can go to find out what are your endo clinics across the UK. And because there are a number of women that don't know that they have endometriosis, they just have painful periods and think that's absolutely normal. It's absolutely not. Absolutely not. So what they are, sort of going back to my story really, but what they are trying to do now is change that system within the NHS so it's a much easier fast track. So what they're asking women to do is diary what they're doing before they go, which I think is much better, which is helping with diagnosis and earlier diagnosis, which used to be sort of 10 years is now coming down to 7.5 years. So back to my story where it took like at least 10 years and I went through 8 different specialists. I was told all sorts of things. I was told a lot of the time it was psychosomatics, it was all in my head. So when they found everything in my pelvis, it was almost a relief.
Yeah.
Actually, there was something wrong. I wasn't just completely crazy, you know, it was painful. And then coming up to sort of, I'm 47 now, but coming up to sort of 41, 42, I had a lot of relapsey type things. So I was tired again, I was in pain again, I was getting back. So I had to go back to my gynecologist and say, you know, I'm feeling these things. So going back to the chocolate cyst, they call it a chocolate cyst because it's full of old blood. So it looks like dark chocolate.
Okay.
And when they get to a certain size, they can burst and the toxins within it are absorbed by the body, but it can make you very ill. Wow. And I've had that happen twice. Over sort of a period of about 6 years, and it just leaves you completely paralyzed. You can't move for a good sort of 10 to 15 minutes. The pain is so intense.
Yeah.
That's if they burst. If they don't burst, sometimes they have to be surgically removed, and they can just be normal cysts, and I think they call them a cloudy cyst, so that can be filled almost like a fibroid. And the chocolate cysts are filled with old blood, and what happens is the ovary starts to overproduce a cyst,
Mhm.
and it can then just have the blood kind of flowing into it basically, and then it just dies
Wow.
in there. There's nothing they can do, so it's just sitting on the ovary. And of course, that's pushing on elements of the pelvis and what's within the pelvis. So sometimes it can cause issues with the bowel. So for mine ended up knitted. And the reason it became knitted was because every time I'd had surgery or the endometriosis cells were leaving scar tissue after bursting. So for example, if a cyst burst, and I'd have baby ones burst as well, they cause pain, but not as big as the big ones. It would cause scarring, which are called adhesions. So every time you move, it feels like someone's kind of tugging your hair, like bit inside your body. It's quite a feeling. And it does affect everyday life. You know, if I twist quickly or move, you know, I can go, oh, it's still there, because it's scar tissue. It will always be there. So some of the women that are now going through the system could be at any level of those. Anything could be happening. So just going back to that, really, a chocolate cyst is one that's filled with blood.
Wow. There's so much in that, you know, in terms of unpicking like endometriosis and like the grades of severity of what somebody might experience. I mean, it sounds like it would be quite a difficult thing to diagnose. And I know that you mentioned that it took quite a many year for you to actually get your diagnosis. And I think we'll move on to diagnosis a bit later. But in terms of what actually is causing a cyst, what is that like? How is a cyst what does that come from? Am I right in thinking that is linked to eggs maturing on the ovary or in the ovary? Is that right?
Yeah, and we don't know the correlation of why there are more cysts and endometriosis being present. It just seems to be a correlation, but we're not quite sure why. And even with the funding that Endometriosis UK gives towards the NHS, it's not enough. You know, diabetes is more not well known, and yet endometriosis is more common than that. You know, 1 in 8 women have endometriosis. It's just absolutely incredible, and don't know it. You know, so yes, going back to the cyst, it's basically the ovary that is sitting there gathering all these
Cysts.
So basically, cysts and endometriosis not necessarily are a correlation. So I think if you've been diagnosed with cysts, I think the message here is don't panic that you definitely have endometriosis. But if you do have endometriosis, the good thing about it is that the earlier you know about it, the quicker you can fight it. And regardless of what the side shoots are, so for example, some of the diagnosis that comes about pre-endometriosis are things like IBS or PID, which is obviously irritable bowel syndrome, and PID is pelvic inflammatory disease. And they're often done before endometriosis even comes into the equation, because GPs just don't have that kind of knowledge. We're getting there. It's getting more and more into the NHS, but it's difficult. So I think going on from here, we kind of know what it is, and people can ask questions. I have no problem with that. But I think what we're trying to do is, where do we go from here? You know, what happens next? And for me, diet and exercise was a huge thing. And a lot of women that have endometriosis, oh, I don't want to move, I'm in pain. But as soon as you push hard in your mind, you can kind of start to overcome. So, you know, no lower sugar, like cut out your fats and to just get your body stable, and then just do, you know, 10 minutes walk or something, just move. And I know it's hard when you're in pain. I know exactly how that feels. But if you do move, you come back and you're like, okay, because your mind is strong and it will push the body as well. So, you know, you can rest afterwards. It's not a problem. You know, give yourself permission. I think you can control it rather than it control you. And that was one of my focuses, I think.
That's amazing. Like, just to think that, you know, there are options, even if you haven't got the diagnosis, possibly, that you could start implementing, because it does sound like it takes quite a while to get a diagnosis reliably, especially going through the NHS pathways, post-COVID as well, you know, access to resources. I think quite a few people are seeing delays in the UK in terms of any diagnosis at the moment.
Very much so.
So in terms of the symptoms, because I think we did sort of talk about their pain and actually just being able to get out of an exercise and inflammatory kind of factors, what kind of symptoms might we start seeing and want to query, especially from a perspective of a sports therapist? If you get some or a therapy related practitioner, somebody coming in with abdominal or non-abdominal regional pain or local pain, what might we be looking for? What might we think, oh, well, this might be something worth flagging?
So from my own experience working with women that have hormonal change issues from whatever age they come in, and I see women from sort of 12 years old, so definitely younger ladies that are just starting puberty and perhaps just starting their periods, to women that are, well, I've seen an 80-year-old that's way, the other side. So from my own personal experience as a practitioner, I would say that I would be looking for, personally, whether I'm male or female as a therapist, I'd be looking for how do they feel? Oh, I've been having lots of headaches. Oh, I've got a lot of tummy ache, backache. What is that? Could it be that they're sitting in a funny chair? What is, so investigate, talk with your client, that's what I do, it's therapy. But for me, I think I would just be asking questions and reoccurring things. Why is somebody coming to you in the first place? As a massage therapist, we deal with soft tissue. So we are very aware that, oh, I've got a bit of back pain. And if that woman keeps coming back in with back pain, there's lower back pain, do you get, ask the question, when was your last period? Are you okay? Do you have good periods? Even if you're a male therapist, that woman is in your trust right there. It's just you and her. There's absolutely no reason why you can't say, just because of the overall health, actually, I need to ask you some questions about your menstruation and how you're getting on. Oh, I'm fine. I'm absolutely, or she'll say something like, do you know what? I really do get, a lot of pain. Or I remember our last podcast was about excessive bleeding, and obviously that should help women now as to, going in. But I think, in essence, as a therapist, ask your client.
Yeah, just get in there and kind of ask the question early as well, because I think the longer that you see somebody, I suppose these things kind of can come through the woodwork a bit with time. But sometimes if something comes up and it, you're dodging about the question, not really asking, it's not really taking control of the situation too. And actually, if somebody's feeling a little bit like helpless, I guess, in their situation, it may not even be something that's on their mind. You really are responsible for that, bringing it up and flagging it. And there are other situations where, a diagnosis can occur because we're not medical in any way specifically as practitioners, but we have some level of an anatomical and health related knowledge that can open doors and pathways for people to get referred to the services they need. And it is our responsibility. No matter what the health issue. Who was it for you that kind of, I suppose you said you'd seen several different people. Did you bounce around from kind of different services before you got on the right pathway to a diagnosis? How did that work out for you?
I didn't know what was going on. I just had a lot of pain and a lot of back pain, and I also kept fainting. So I think the pain was so high, it was just knocking me out. And I couldn't, and I'm not one for taking a load of painkillers unless I really have to, but the pain was so bad I couldn't not. And of course, it's a chemical painkiller, so then that has other effects. So for example, I'd be constipated because I've been taking too many painkillers. So that's causing more pressure on the pelvis as well, which, you just end up in this vicious circle. And again, that goes back to diet, making sure you've got enough fiber going through your system, you're hydrated, etc. But of course, I'm young at this point. I haven't got a clue what's going on. I wasn't a therapist at that point. So I think it's really interesting for somebody, to have this platform now to be able to say, guys, girls, have a look at what's going on. So for me, I think my first port of call was the GP, who was particularly unsympathetic. And at that point, it was my first diagnosis was it's psychosomatic, and perhaps you should try antidepressants. And that was quite frustrating at the time. But I was adamant that I was in pain and it wasn't in my head. But I think you've got to be quite a strong-willed person to kind of do that. And I don't think that's necessary. I think for now, if I was going to go through that route now, I would go to a GP with the notes. So I would use a period app on my phone, which we have access to. I didn't have access to that back then. It's 20 odd years ago now. And I would go with a notepad and pen saying, I have been suffering this on a monthly basis, that on a monthly basis, etc. You know, I break out in spots every, you know, whenever, or, you know, I've got really serious back pain, or I can't get out of bed, or whatever. And of course, I think one of the issues could be, it looks like a possible depression because you're in such a low state because you're in pain. A GP only has you for a short amount of time. So the more information you go in with a tick list, I guess, if you like, it's helpful, not that you're self-diagnosing, but it's helpful to know where you are so that the doctor can help you, I feel.
Yeah, because like you say, that amount of time is not long for somebody to get the full impression of what your day-to-day life looks like, because so much goes on. I think even we as individuals, when we're going through our daily life, you know, it's really hard to keep track of things. And actually, when you try to start using these, initially try to start tracking symptoms, just from my own experience using my own system for another issue, which, like you say, we talked about that a bit in the first episode, it can be quite difficult to keep track of things and make sure that you're actually recording things as they happen, because a day or so down the line, you just forget. And you mentioned apps there. Is there anything in particular? Was there an app that I think you favoured one? I can't remember the name of the app there. You might need to remind me.
I can't remember what it's called actually. But I think it's just period tracker.
Yeah.
But if you Google it, there's loads of different types of apps. Just find one that you find, and on it you can do. I think it's got things like moods, what have you eaten, what have you drunk, things like that. But also from a perspective of you and the NHS, I think a lot of people have a mindset that I'll go to the doctor will fix me. Be responsible for yourself. You know, it's you that's suffering it. So, and I'm not saying you have to fix yourself, but I'm just saying that you need help. But if you go armed with all the stuff and say, look, I've done everything I can, I think I need this. You might not know what you need, but at least if you go saying, I think I might need this, because I've tried everything else, the doctor's already on your side, because they're going, okay, I think I need referring to a gynaecologist. I've tried everything I do. And the doctor goes, okay, great, 6 minutes gone, brilliant. Do you know what I mean?
Yeah.
So I think that's helpful now in our society now to say, look, I've eaten this, I've taken this, I've done my research on endometriosis. It could be that I would like to be referred to an endometriosis clinic, please.
Yeah,
you know.
And if you can find out the name of, if you've got in with, say, Endometriosis UK, you can start eking out the details of like, who's the best person to go to in your local area? Is there even anyone in your local area that's recommendable?
Go on to Facebook forums, go to your local. So Endometriosis UK do support groups. I'm the Bedfordshire co-leader for the support group for Endometriosis UK, but they have local, you just go onto their website and they have local support groups. So just go and ask one of the leaders, find their Facebook group, because there's often one, there's one for us, Hertfordshire and Bedfordshire one. You can phone their phone lines there. If you go onto their website, they will tell you what's open. You can go onto the BSGE website and then go via them. You can go to your GP, email your GP. Some people, they have this system on the email system, or they have it's like Patient Online or something, where you can ask messages directly into the GP. But I've found that if I'm helping the GP, which is your first port of call, you have to go to a GP and then say, I need to do this. The more you're armed with stuff, I just believe that you'll get a faster way forward and you'll get help quicker.
Yeah,
you've got to do your own.
You need a bit of self-determination as well to get there, because you are on any medical journey probably going to face barriers and delays, and you do have to chase things up. It's not ideal, but yeah, I mean, like just before we started recording this, we were just talking about how different, you know, if you're from particularly a different maybe region of the world to us, different country, you might have different barriers. And we obviously can't speak for people who live outside the UK. Our experiences here in the UK are very much, we are in a privileged situation when we have access to a free national health service. But if you're listening from another part of the world, you might not have access to that. So it's really important that you utilise what free resources you have available. If you can't get, unfortunately, if you can't get access to charitable organisations in your own country or area, you know, you might be able to use our UK-based resources, which there are an abundance of in relative terms, perhaps. And we'll put the links in the show notes. So if you're uncertain where to look, hopefully, you know, just the NHS website, which is our National Health Service in the UK, and Endometriosis UK. And like Deb says, there's also, is it the yeah. So we can put those links in, and you could start kind of taking some ideas down and noting and contacting people. And
support yourself, you know, and then like you say, from wherever you are in the world. Absolutely great point. I think, yeah, I'd forgotten that we'd talked about that beforehand. Yeah. So yeah, wherever you are, we've got the World Wide Web.
Yeah, isn't the internet amazing? It's making this happen. If you're not watching us through the video, we are video recording this. Whether or not it will reach the heights of YouTube or not is down to timing. But yeah, and I think from that perspective as well, if you're listening as a therapy practitioner or, you know, somebody who works in health, hopefully these resources can provide you with somewhere to signpost people to if you don't have access to maybe a local health service that takes care of these issues. Yeah, so in terms of I kind of want to circle back to diet, I think, because I felt like that diet and exercise you mentioned, and those are the things that I think as exercise or manual therapy practitioners we can kind of be a bit more helpful with, especially exercise, I suppose, and maybe also soft tissues, tissue therapies, that type of thing. So what do you recommend, and what worked for you, I suppose?
So hands-on massage is fantastic for pain relief of any kind. You know, it really helps for touch and for relieving of muscle pain. So even if the pain within the pelvis is not actually muscular, that release and that calm and that caring touch can actually be really great. Some of it can be painful, but often one of the things with pelvic issues that are to do with endometriosis, some women, for example, my womb is retroverted, which means that it's been pulled backwards. And then it's stabilized in a backwards position because of adhesions. So to relieve, I know when I'm in pain and my lower back is killing me from where the scar tissue is. And I know just to have that maneuvered, it feels so much better. And often it can pull the pelvis out of alignment. So the muscles start to move, the bones start to move.
Wow.
You know, so we can have pelvic misalignment because of stuff going on with inside the womb and the alignment of the internal organs. So actually manual therapy, so soft tissue massage, whatever you want to call it, to relieve some of that muscle tension. And then we can go back onto all the fascia and everything else, but I'm just thinking very simplistic terms of just calming the whole system down. You know, your fight or flight is going nuts because you're in pain, your adrenals high, etc. So you kind of just need to have that time to just rest, even if it's what I would call a pretty massage. A very, very super relaxing one. It's also very good for the system. You know, your endocrine system's just going to calm down.
Yeah.
So it's worth, I think a lot of people think of it as a luxury, but it can be used as a good pain relief. For example, using a TENS machine, you know, sends out the little emitting points that will send nerve messages to the brain to stop pain. Well, you've got the same thing going on with touch. You know, it's sending different messages to the brain to help that.
Yeah, I think like, and Matt talks a lot about that in some of the commentary on the STA podcast, the weekly podcast, and you know, as the STA are a massive advocate for the use of manual therapies, and there's a lot of, you know, research going on and debate over the impact that it can actually have physiologically, and structurally, you know, that's questioned. But in terms of the nervous system and having some impact, our experience of the world is programmed and created in our nervous system. You know, all that we detect and all that we do is channeled through our nervous system. So having a way of you know, affecting that without big cost or either financially or health wise, you know, the trauma of surgery or medications, it is really powerful modality to use.
Very much so. And I think, like you say, going back to diet, just switching back to what you said about Matt there, and going through the weekly podcast that Matt does. Matt had the Massage Collective on for an interview as well, and they were saying exactly the same thing. So yeah, go and mention him for the Massage Collective. Yeah, who are again saying, you know, we are not physiotherapists, we are massage, and we're proud to massage because of the benefits of that. But Fiona, going back to what you said about diet, I think it's very important to understand what affects your body. So people say, oh, I've gone on this diet, that diet, whatever, and nothing works, but why are you dieting? And surely we're always dieting, that there shouldn't, our diet is our life. It shouldn't be, I'm going on this diet, on that diet. You eat, that's a diet. You know, it should be like that, really. And what you're putting into your body and what that affects. So each single person has a different output. So, you know, once you get to a certain age, you know what's good for your body. You know, shoving loads of chocolate in is probably not going to help you much, you know.
Much to my dismay. Of chocolate.
But, you know, there's a counterbalance for that. And I'm not saying throw a load of chocolate in and then go and do an 8-mile run. I'm saying, you know what's good for your body, and what is good for you may not necessarily be good for other people. So you may have other complications, and often with endometriosis, there are other complications. For example, with me, I have psoriasis. I have a specialist type of psoriasis called pustular psoriasis, and it's brought on because of the endometriosis. So my autoimmune system is already on the back foot. So it creates other, and of course it's a skin condition because skin is the largest organ, which I've said before. So it's warning me, it's going, you're not doing well. And another thing is the inside of our nose as women is a very, very similar reaction to what's going on down below. So often women will get nosebleeds, sores in the nose when there's something wrong with the pelvis. So it's amazing what we have mirroring within our body, and just being aware of that, being much more aware of what's happening, why we're lower. So for example, in me, I will get when my zinc is low, I will start to get more mouth ulcers because I know that my hormone fluctuation is coming closer to a period, and as a woman you'll start to go, oh, I've got those spots again, or oh, I've got that again. What can I take to counterbalance that and try and keep it balanced? It's not an easy task, I don't think.
No, and I was just thinking as you were saying that, because of I think that Gary and Matt have talked about, I think even they may have had an episode on York with York Testing Labs, which is a company in the UK that are able to profile for certain inflammatory markers, so allergies and things like that. And I think that services like that, if like you and I may have a history of tracking symptoms, and we've got a degree of research that we've done for ourselves about our own kind of symptoms. But if you're just at the start of this journey, or you're helping somebody that's just at the start of this journey and not sure maybe if there is some kind of inflammatory situation, like you mentioned psoriasis, perhaps this is something worth investigating with a bit of help from a company that can actually test for that. There are lots of online companies that provide testing for allergies and allergens or that kind of thing. I'm not an expert, but you could you could look at that, if you're not sure with diet, and we're certainly not experts in diet, but having some kind of ability to track your symptoms, track your diet, work out if you are allergic to anything or there's anything triggering symptoms is a good starting point maybe. And it's interesting that you mentioned psoriasis. Actually, that also triggered a memory that I listened recently to Jack March's visit to Matt's podcast, the SDA podcast, Sports Therapy Association podcast. A great episode talking about, I think it was, I'm not going to pronounce this right, psoriatic arthritis, is it? So he's a rheumatology expert or rheumatology physiotherapist. Some fantastic information there, and like you say, there can be overlapping kind of symptoms, overlapping conditions, and I feel like the women that I've spoken to, certainly in the past few months since we started this whole kind of project to have a women in sports therapy podcast, have talked about that with me, you know, having multiple conditions and how to, you know, do you define it as like one condition, you know, all together, or is it just a whole load of different things going on?
I sort this out,
yeah. I mean, and really at the end of the day, does it actually matter too much, because you're just dealing with a system at the end of the day? I mean, it could go anywhere.
You just need to equalize, you know, and balance out. And how do you do that, and what advice? I have lots of women, men and women, that come to me in different veins of life. And there are some women that come to me in the perimenopause, menopause state, which I know we'll pick up another podcast. And some of them are runners, and they say, you know, I've had this terrible run, and I'm like, right, where are you at in your cycle? How old are you again? Or what's going? I'm just asking questions, you know. Like I've said before, just ask your client, like, where are you at?
We've just got to ask the question.
Ask question. So I just want to go through a couple of stats, because I know we're going to be locking out our time frame. So I think, just what do you think about going through some of the stats? It might be helpful for our listeners.
Yeah, absolutely. I think if you want to perhaps share some of those, that'd be helpful for everyone.
Yeah, so it's just helpful to know that you're not alone, I think, because when you don't know what's going on with your body and you've got a lot of pain, and it could be endometriosis, or you already know it is endometriosis, it can feel very isolating. And I did a face-to-face group meeting last month with my co-leader, Kat, and the ladies that came were really happy that somebody had gone through this and understood it and knew where to go and things like that. So just really the stats. So 1 in 10 women of a reproductive age in the UK suffer from endometriosis. Now, I said earlier that that's actually about 1 in 7. But I think we discussed this before about endometriosis. The diagnosis time is coming down. So it's actually more common than diabetes. And when you think that only half the population of women can suffer this, it has been found in men, in the brain and the lungs and stuff very occasionally, but it's mostly women. So if you think that diabetes hits men and women, and how common endometriosis actually really is, it's quite incredible that we don't know enough about it still. Worldwide, we're talking about 10% of women have endometriosis worldwide. So we mentioned, you know, worldwide, that's 176 million women across the world, basically. And that's not even people that are counted. We don't actually know. Another subject that we'll probably pick up another time is infertility, and the need for IVF because of endometriosis. But we'll pick that up as a completely different topic, because there's loads of other IVF, and how that affects women in sports therapy, how that affects what we do. So all the running, swimming, triathlons, and how that's effective, and wanting a family life as well, and how that fits in. It's quite, I think we'll pick that up another time. I think the other thing is, it is the second most common gynaecological condition in the UK. So that's huge, you know, it's a biggie. On average, it takes about 7.5 years to diagnose it, which is not great. It's a long time to be backing around with a lot of pain.
Could be better.
And most importantly, obviously the cost of living is something that's very prevalent on people's minds at the moment. All of our listeners are probably thinking, fuel prices, food prices, fuel in the home prices, electricity stuff. And endometriosis can contribute to our UK economy with women being off work, and it's valued at something like £8.2 billion across the UK. That's a lot of money. But I think that may change. I think we discussed before about COVID, much more flexible working. Women can be wrapped up at home and working on a PC. But women in sports therapy, like myself, like yourself, we have to go to work and work. So it depends on what your job is. So these are just some of the stats, basically. And the biggest stat of all is that there's no cure. So the quicker you are diagnosed and know how to handle it, and you're living with a condition, and it's actually classed as a disease, and they're looking into disability because of it. But the quicker you know about it, the quicker you can stand and fight it and live with something. It is livable. You can live with it.
Yeah, I think that's a really upbeat kind of note to sort of end on, really, for this podcast episode. Like, there is hope if you are experiencing problems that you feel are unsurmountable with getting a diagnosis, even you're just at the start of the journey and not sure what your diagnosis might be, if you have one in the pipeline. There are things that you can do for any gynaecological or related condition, and obviously we're pinpointing this and addressing this from the viewpoint of women. There are people who identify differently and may be experiencing all other kind of confounding factors that may be making the diagnosis even more complicated. Whatever your journey is, that there is stuff out there that can be researched and implemented, and hopefully this is helping direct you in the right kind of direction, pointing you in the right direction. So I think that's all for today's episode. We're going to have to say goodbye for now. We just want you to know that obviously if you're working in sports therapy and a related field maybe, and you want to be better equipped to help you yourself or your clients or colleagues by any of the issues that we're covering in these episodes, then you can find out more via the WIST website, which will be linked below in the show notes. And also please do listen to any of the other episodes that we have. I think
they're available across all your favourite podcasting platforms, including Spotify, Apple Podcasts.
Yes, and also when there's a new episode, you can subscribe and view that and download that to listen to anytime.
Yeah, and if you can't wait for that, then you can check out the previous episodes on your podcasting platform of your choice. So we do have the email address as well, so we can be reached if necessary, if you have further questions, at wist@thesta.co.uk. But you can always find us on the STA website as well, and there's links on there to go straight through. And Gary's always happy to answer any questions. I'm sure.
Yeah, please do. If you have any questions that if you're not getting through to us, you can always go to the STA, to the local representatives. Two fantastic resources on the STA website, which we'll link to in the show notes. So much that we can kind of call upon here with a fantastic membership from the STA. So I think that's all from us for now. So hopefully we'll catch you in the next episode. Until then, goodbye.
Bye.